Ladies and gents, welcome back. The provinces have lifted most of the mandates and restrictions. The federal government, of course, dragging their feet. And for those who have been coerced into the first 2 doses, definitions mean everything if they're looking to avoid having to take a booster. Feds consider definition of fully vaccinated in review of federal worker mandate. This is from City News. The federal government will consider whether to include booster shots in the next version of the COVID-19 vaccine mandate for its workers. The Treasury Board said as it reviews the rules. The government must review the need for the policy, which currently requires federal public servants to get 2 doses of the vaccine or face unpaid leave after 6 months. That timeline runs out this week, and while Treasury Board has consulted with the unions over the last several weeks, the Public Service Alliance of Canada says it is in the dark about which direction the government will go, and we all know how the unions have been faring. I covered this on back in the beginning of March, where the unions feel that they're not obligated to grieve Air Canada's decision to enforce federal vaccine mandates. And that is I believe that's the CUPE, the Union for Public Workers. They have said you will see a renewed policy on April 6th, which is today. So I'll be following up on this one. Chris Alward, national president of the union, said in an interview, "I have no idea what the new renewed policy might look like." And we're all kind of sitting on the fence here, wondering where they're going with this. While the review could deem the mandate is no longer necessary, the government could also opt to expand it to encourage more members of the public service to get the booster shot. Encourage. I love the language that they use here. Encourage. It's mandate. It's enforce, not encourage. Any decisions will be based on science and the advice of the public health officials. Mona Frontier, president of the Treasury Board, said in a statement Monday. Now, all of us have been paying attention to these rules, because a lot of people, even if you're not a federal worker, people want to leave Canada, go vacation elsewhere, move on with their lives, maybe leave the country for good. But yeah, you have to qualify. So this is from travel.gc.ca. Check if you qualify as a vaccinated traveler. To qualify as a fully vaccinated traveler in Canada, you must. So fully vaccinated, in quotes, is a legal term. Now, this is a legal term you have to live by, and these definitions change depending on the whims of the officials and bureaucrats here. So to qualify as a fully vaccinated traveler currently, as of today, as of April 6th in the morning, you have to have received at least 2 doses of COVID-19 vaccine accepted to travel, a mix of 2 accepted vaccines, or at least 1 dose of the Janssen/Johnson & Johnson vaccine. Have received your 2nd dose at least 14 calendar days before you enter Canada. So you can't just take it quickly and get back in here. Example, if your 2nd dose was anytime on Thursday, July 1st, then Thursday, July 15th would be your first day that you meet the 14-day condition. Have no, or in then another bullet point is you have no symptoms of this, which is any symptoms of any common cold. If you even catch the common cold, even if it's not that, you're not allowed to enter because it could. But here's the one that everybody is concerned about: the ArriveCan app. You have to install an app on your phone that can track you, and yeah, that is that. Now, down further in the article, we have, while the massive Omicron wave that washed over Canada in January and February has just receded, that big wave, that the common cold that was reported as the bubonic plague has receded. The country is likely to already in the midst of a resurgence. The boogeyman's back, everybody. You didn't even know about it. Chief Public Health Officer Theresa Tam reported on Friday as she clamors to her salary. In general, though, Tam said policymakers are moving away from mandates for booster doses, and that is what we're all hoping for. We're looking to get rid of this and move on with our lives. I think most of the audience here can attest to this. We want Canadians to want to get it, but because it makes sense from a serious outcomes perspective, she said in a briefing on March. We want all Canadians to get it, but we sowed so much distrust that people are refusing. This report by the Canadian Press was first published on April 4th, 2022. So that's where we stand, ladies and gents. We are unsure. We're unsure, and we have to constantly look at the regulations to see how we're going to move forward with our lives on a daily basis. We're hoping to get past this and move on so we can live normal, free lives in a free and open society. That's all I got for you on this at the moment. We'll see you in the next one. Keep on trucking.